Welcome to Nutrition Equity, the podcast that explains the interaction of nutrition, health, and social justice. I'm your host, Joanna, and this week we are talking with Susan, and an inspiring advocate and beacon in the strength within the community. Susan is not only a patient, but also she's the editor and of the MSUD Family Support Group newsletter, and holds the esteemed position of MSUD Chair. And I know you said you're also the VP of the National
section for PKU and
NECPAD. I can't pronounce. I don't remember what the acronym is. But with your with her vast knowledge and her firsthand experience, she has dedicated her life to raising awareness and fighting for the rights of individuals affected with maple syrup urine disease, or MSUD, through the New England connection of PKU and Allied Disorders. Okay, so first of all, do you want to explain what MSUD is?
Sure. And thank you for having me, Joanna.
What?
And thank you for having me, Joanna. I appreciate this opportunity to speak with our community. So MSUD, what is MSUD? MSUD is maple syrup urine disease. In the liver are enzymes. Enzymes break down protein. Protein is made up of 20 amino acids. We are missing an enzyme or have an inactive one that breaks down the 3 essential amino acids: leucine, isoleucine, and valine. This can cause, in severe cases, a metabolic crisis, brain damage, and edema, and in very severe cases, death. High protein foods of any type of stress, sickness, and in some cases heat, and to some even too much exercise, can cause the levels to go up. In less severe cases where levels are high, we can experience urine that smells like maple syrup, dizziness, poor appetite, brain fog, lethargic, weak muscles, poor balance, slurred speech, and panic and anxiety attacks.
Okay, this is another one that's off of the list that I gave you, but how does it differ from diabetes?
So diabetes is based on sugar. So if your sugar is off, bad things can happen. I know you can go into metabolic crisis from that. That's a big comparison. With us, it's not sugar, it's leucine. In fact, we want sugar, unless you do have diabetes on top of MSUD, which is a whole nother issue, because sugar has calories. Calories can help our leucine levels to go down. So it's similar, but also opposite at the same time.
Right. Okay. Can you tell us about your story? So how you were diagnosed and with maple syrup urine disease?
Yes. I was picked up during newborn screening. I had been in a hospital up until the night before the results came back for an unrelated reason, and then sent home. Once I was home for the first time, I wouldn't drink my bottle. I would literally take my hand and hit the bottle. The doctor just said that it must be the way I was being fed. It wasn't. High levels can affect your appetite. I was essentially not hungry because my levels were high, and also protecting myself by not having the protein that would make me sicker. The next morning, I was 7 days old, and my newborn screening results came back. My amino acid levels were high for MSUD, so I was sent back to a hospital, but this one a bigger one. At that time, my leucine level was so high that I needed to be put on dialysis to get the protein out of me. Today, in America at least, MSUD babies are given an MSUD form of TPN before dialysis is given. TPN would not be on the market, as far as I know, until 2 years after I was born. I was then in a hospital for 3 weeks from that point. And I was sent home to live my normal life.
As the editor of the MSUD Family Support Group newsletter, MSUD Chair in Canada, could you share some insight into what into the work you do for individuals with MSUD and promote and support within the community?
Sure. The MSUD Family Support Group is a group that provides network opportunities for families and professionals in the field of MSUD and offers them advocacy and research, works on advocacy and research on their behalf as well. My role is a newsletter editor. In this position, I gather and edit articles for our bi-yearly newsletter. The newsletter consists of articles from the support group, professionals, families, and vendors. On CANPKU Plus, I am the MSUD Chair. I do want to emphasize that plus in the title is for MSUD and all related diseases to PKU. They call them brother diseases. And their mission is to help make the lives of these families easier. There I am the representative for MSUD Community Canada. I provide one-on-one support and advocacy along with running some events. For example, a few months ago, I ran a virtual open house for the group. I'm also one of the vice presidents for New England Connection for PKU and Allied Disorders, NECPAD. This organization supports people with MSUD and similar disorders who reside in New England, which are the 6 states east of New York: Massachusetts, Rhode Island, Vermont, New Hampshire, and Maine. We provide support and network opportunities to families, offer financial, medical opportunities, hold events, and advocate on their behalf.
What are some of the unique challenges to individuals with MSUD?
Unlike some similar disorders, a patient with MSUD unlike some other similar disorders to MSUD, someone with MSUD cannot go off their diet unless they have a very mild form, which is extremely rare to find. This is because our body cannot break down the 3 essential amino acids I spoke of earlier: leucine, isoleucine, valine. When it comes to a point where our bodies can't break down what we have been given, such as if we have too much leucine in our systems, we can go to metabolic crisis, as I mentioned earlier, get brain edema, and go into a coma and even die. With a proper dietary monitoring, though, of low-protein food and formula, MSUDs can live a perfectly normal life. That said, we may need additional help from speech, occupational, and physical therapists, but there's every reason to believe we can overcome any challenge we face.
Let's see. Could you shed some light on the disparities and barriers that exist in accessing appropriate care and support for individuals with MSUD? What are some of the major obstacles you observed, and what steps do you believe should be taken to improve the nutrition equity for those affected by this condition?
Sure. So there's 3 main things that come to mind. The first is a lack of clinics and doctors. Most states have very few, if any, clinics that treat MSUD, and some only treat children. If they do treat adults, often they are within children's hospitals. As for support, there's so few people with MSUD that we are spread out throughout the country. It is thanks to internet and those that are willing to travel that have created these connections. To help, the MSUD Family Support Group usually has a symposium every other year. Due to COVID, it hasn't happened in a while. Local regional support groups such as NECPAD hold events to bring the community together on a local level. Since COVID started, there have been a number of virtual opportunities to connect as well, which I think has been a great addition to the support network. And finally, I left this one to last because it is such a more complicated one, but also a more important one. It's the cost of a low-protein medical food and formula. Unlike foods that you buy in a store that have a great market for it, there's very few people with MSUD and similar conditions on these diets. So the food and formula companies have to up their prices in order to make a profit. These can add up to thousands of dollars a month for an individual with MSUD to have life-saving food and formula. Some but not all states have laws that require health insurance to cover the cost. A lot of the states have a limit to how much they would cover, or cut coverage at a certain age, or don't cover it at all. Or the insurance company can also find a loophole that makes it so they don't have to follow state laws and cover it. This can cause a lot of stress and anxiety for individuals with MSUD too, which can increase their levels as well. For MSUD, there's no funds out there to help. Besides NECPAD, and that only covers the six New England states I mentioned earlier, there's no other funds I know out there that can help people with the food and formula coverage. Currently, there is a bill that the MSUD community, along with other similar disorders, are trying to pass on a federal level. This bill is called Medical Nutrition Equity Act. We do have a number of senators and congressmen who have already agreed to sponsor this, which we are very grateful for. But it has not been reintroduced during this congressional session yet. We currently are looking for support, especially from Republican representatives in Utah, Oklahoma, and other places across the country. We are also asking patients across the country to share their stories at nutritionequity.org to show the government officials why this is so important to our community.
Okay, see, from your perspective, what are some of the key the key areas of research development and field in the field of MSUD? Are there any promising treatments or therapies on the horizon that may be improved, that may improve management, potential cures, and for this condition? I just saw a post on this on Facebook also.
Right now, there are some studies in the very early stages, but nothing that is even being tested on humans yet, or that a date for human testing, or that has announced a date for human testing. I know that there are some drugs that are included in the studies in the at-home blood monitor, but like many rare diseases, there is a lack of funding to support this research and studies, which means there are very few studies out there, and those studies that are out there run very slow. If anyone any of our listeners today would like to help and donate to support these trials, they can go to MSUD-support.org /donate-2 to donate and help these research studies speed up the processes.
See, how do you envision the future of equity is achieved for individuals with MSUD? What steps do you believe need to be taken on a social level to ensure that everyone, regardless of their circumstances, has equal access to the necessary nutritional support and resources?
The Medical Nutrition Equity Act needs to be put into law. It's as simple as that. We need to get enough congressmen and senators support so it becomes a law in America. It is as easy as that.
Can you share some inspiring stories and testimonials of individuals with MSUD who have overcome challenges or achieved success in their lives? How they managed to thrive despite the obstacles they face? I realize you can't mention names on this too.
Right. Sure. There's many stories because MSDs can live a perfectly normal life. They just eat differently. So some have gone on to go into the medical field. Some are teachers. Some are in the IT field. Some are strong advocates in the community, and some have children of their own. One thing that you often see is that in the community is that there are strong advocates for themselves. Like many in a rare disease community who have to be advocates in the doctor's offices or hospital settings because so little is known about their disorders.
Let's see. As an advocate and leader of the MSUD community, let's see, what advice do you have for individuals who have newly diagnosed who have been newly diagnosed with MSUD, or families? What resources or support systems would you recommend they seek out to navigate this journey effectively?
I always tell the families there's no reason why their child won't live a normal life. They will just eat differently. I always suggest they join the MSD Facebook groups, join the MSD support group mailing list. If there is a regional group in the area, I would recommend them joining that too. To find out if there is a local organization in your area, you can visit www.pku-we-r/affiliate-council. Find out, and they will be able to tell you if there is one in your area.
Okay, let's see. Finally, what are the hopes and aspirations for MSUD advocacy and support? What changes or achievements would you like to see in the coming years to improve the lives of those affected by this condition?
The most helpful advancement would be an at-home blood test. Of course, I would like to see a Medical Nutrition Equality Act passed. I would also like to see an official MSD Awareness Day in our country. I tried to get one passed years ago, but not much was happening in the government at that time. So I put it on hold. Hopefully in the future, we'll be able to get it through the government.
Let's see. And this concludes our enlightening conversation with Susan, an incredible advocate and leader for the MSUD community. Susan, thank you for your incredible advocacy and and being an incredible advocacy and leader in the MSUD community. Sharing your personal story and knowledge with unwavering, committed to promoting nutrition equity in individuals with MSUD. Thank you once again for as we wrap up, let's take a moment to reflect on the insights we have gained today. Susan's powerful advocacy work reminder reminds us of the importance of raising awareness, challenging disparities, and striving for a future where every individual with MSUD has equal access to necessary nutrition and support they need to thrive. Together, we can continue to shine a light on the uniqueness and challenges faced by those living with MSUD and work towards breaking down barriers to care and ensure equitability, access to resources and opportunities by fostering a community of support and knowledge. Sharing, we can empower individuals and families affected by MSUD and lead fulfilling lives while managing their condition. If you would like to learn more about maple syrup urine disease, get involved in supporting MSUD community, we encourage you to visit the New England Connection for PKU and Allied Disorders, or NECPAD. And another thing you can do is go to nutritionequity.org. There's places you can go to fill out letters to Congress and help that way also. Thank you to our dear listeners for joining us in this episode of Nutrition Equity. We hope it has inspired and reflected our critical intersection of nutrition, health, and social justice. Remember, by championing nutrition equity, we pave the way for a healthier and more inclusive future for all. As always, stay tuned for more thought-provoking discussion and stories on nutrition equity. Until next time, take care and stay nourished to continue the advocacy for a world where everyone has access to the nutrition they deserve. And also, please remember, like, subscribe, share, comment. Thanks for your time.